Hello guys, I'm talking to you here about what CDC is telling us at the end of 2021 about coronavirus and COVID pandemic and the possible adverse events reported after the COVID-19 vaccination. And I'm here on the cdc.gov site. Here in the left you can see safety and monitoring menu, safety of COVID-19 vaccines, and I selected reported adverse events. And now I'm going to read some things that CDC is telling us on their official site. So, Center of Disease Control in the United States. So, first of all, it tells us that CDC has updated its recommendations for COVID-19 vaccines with a preference for people to receive an mRNA COVID-19 vaccine, Pfizer-BioNTech and Moderna. So they're already recommending us some of the available vaccines for this new disease, of this new safety of COVID-19 vaccinations. Some people have no side effects, they're telling us. Many people have reported side effects that are generally mild to moderate and go away within a few days. Many people have reported side effects, generally mild to moderate and go away within a few days. Generally mild to moderate doesn't mean only mild and moderate. You can understand that, right? I'm right when I say this, right? So what you need to know there, you see, first thing that they tell us, COVID-19 vaccines are safe and effective. That's the first phrase with the dot, stop at the end, full stop at the end. COVID-19 vaccines are safe and effective. This is the first thing they tell us. CDC recommends everyone aged 5 years and older get vaccinated as soon as possible to protect against COVID-19 and its potentially severe complications. So this was updated recently. They recommend even for kids starting as young as 5 years old to take these vaccines. CDC has updated its recommendation of COVID-19 vaccines with the preference of mRNA vaccines. They already told us at the beginning of the page. Millions of people in the United States have received COVID-19 vaccines under the most intense safety monitoring program in the US history. And this is a really important one. This one. CDC, the US Food and Drug Administration, FDA, and other federal agencies continue to monitor the safety of COVID-19 vaccines. So they are in a continuing monitorization of the safetiness of these vaccines. This is what they are telling us. You have to know this. You have to read this. You have to get this info. This is officially transmitted to you. So then you can find and judge for yourself what the actual situation is, what you are told to do and not to do, so you can then make your decision about what you're going to do. Virus. So this is adverse events described on this page have been reported to the Vaccine Adverse Event Reporting System, called shortly VAERS. VAERS accepts reports of any adverse event following vaccination. This could be a subject for another video, more in depth about this VAERS site. This VAERS platform allows people to report themselves, to report different adverse events themselves. But of course you have to provide a lot of information: name, where you're from, details about your sickness, about how many days after the vaccine, after this sickness, and many details like that. So I wanted to shortly say this about that platform of reporting adverse events. So, continuing, CDC is providing timely updates on the following serious adverse events of interest. Anaphylaxis after COVID-19 vaccination is rare, and then they give us some detail. I'm gonna go more in this video about, I'm not gonna read absolutely everything here, you can read it by yourself. I'm gonna read some things that I think are really important. Oh, of course, everything is important. You have to judge, analyze, and think of how the things are presented to you. So, going further, thrombosis with thrombocytopenia syndrome after Johnson & Johnson COVID-19 vaccination is rare, and then they give us some information about this TTS. TTS is a rare but serious adverse event that causes blood clots, large blood vessels, and low platelets that help from clots. And they tell us about this Johnson & Johnson vaccine, J&J vaccine. How many doses there have been given until December 8th, 2021, and then how many they identified people who got this vaccine and later developed TTS. I'm going to move on further now. There's another information here, point about Guillain-Barré syndrome in people who have received the J&J Janssen COVID-19 vaccine, also telling us that it's rare, and then continue to explain some things to us. You can read that if you want. I'm gonna talk about these parts. Myocarditis and pericarditis after COVID-19 vaccination are rare. So, what they are telling us about this side adverse effect after the COVID-19 vaccine. Myocarditis and pericarditis. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the outer lining of the heart. So both of them are inflammations in the region of the heart. Most patients with myocarditis or pericarditis after COVID-19 vaccination responded well to medicine and rest and felt better quickly. So first of all, they are talking about most patients with these disorders after COVID-19 vaccination reported, and they reported well after medicine and rest. Not denying it, they are telling us how people felt after getting these adverse events after they took the COVID-19 vaccine. As of December 8th, VAERS has received 1,908 preliminary reports of myocarditis or pericarditis among people ages 30 years and younger who received COVID-19 vaccines. So they're telling us that VAERS, how many reports of these adverse events on VAERS, on that platform, 1,900. Most cases have been reported after receiving Pfizer or Moderna, particularly in male adolescents and young adults, through follow-up, including medical record reviews. CDC and FDA have verified 1,106 reports of myocarditis or pericarditis. So officially, CDC and FDA confirms 1,100 cases of adverse events such as myocarditis or pericarditis after the COVID-19 vaccine. And then, of course, you can learn more about myocarditis and pericarditis, including clinical considerations after mRNA COVID-19 vaccination. And I went to this site, to their link to safety myocarditis. You can see here in the left, safety COVID-19 vaccines, myocarditis and pericarditis. And you can see here the title: CDC and its partners are actively monitoring reports of myocarditis and pericarditis after COVID-19 vaccinations. Active monitoring includes reviewing data and medical records and evaluating the relationship to COVID-19 vaccination. So they are monitoring these reports, people's reports after COVID-19 vaccination about having myocarditis and pericarditis, and they, the CDC and their partners, actively monitoring these reports, so they can evaluate the relationship to COVID-19 vaccination. Myocarditis is inflammation of the heart muscle, and pericarditis is inflammation of the outer lining of the heart. In both cases, the body's immune system causes inflammation in response to an infection or some other trigger. So in both cases, both of these inflammations, the immune system causes that inflammation in response to an infection or some other trigger. Sigma if your child have symptoms of those conditions after COVID-19 vaccinations. Myocarditis and pericarditis have rarely been reported, especially in adolescents and young adult males within several days after COVID-19 vaccination. You're gonna see here immediately, I'm gonna go to these more in-depth information about heart inflammation. What does it mean and how bad is it? So we know what to expect. So they are telling us that they verified 1,100. Let's go back here to this page. As of December 8th, so until December 8th, 2021, on VAERS there have been 1,900 reports, and then they say, through follow-up including medical record reviews, FDA and CDC verified 1,100 reports of myocarditis or pericarditis. So there are verified 1,100 at least, okay, because many people could have had those adverse events and maybe they just didn't report them. So going on to see what these myocarditis and pericarditis mean, so you can know what to expect. How bad can they be for yourself, if you might be one of those people who have it, who get them after taking the COVID-19 vaccinations. What you need to know on this page about myocarditis and pericarditis, what you need to know: cases of myocarditis reported to the vaccine adverse event reporting system have occurred. And we have 3 cases here. After mRNA COVID-19 vaccination, Pfizer, BioNTech or Moderna, especially in male adolescents and young adults, more often after the second dose, usually within a week of vaccination. Then, most patients with myocarditis or pericarditis who received care responded well to medicine and rest and felt better quickly. So CDC is telling us most patients, so not all, most patients with myocarditis and pericarditis who received care responded well to medicine and rest and felt better quickly. Most patients. Then they continue saying, patients can usually return to their normal daily activities after their symptoms improve. Those who have been diagnosed with myocarditis should consult with their cardiologist, heart doctor, about return to exercise or sports. More information will be shared as it becomes available. This is interesting. More information will be shared as it becomes available. So that means we might not have here all the information that could be relevant. Both myocarditis and pericarditis have the following symptoms: chest pain, shortness of breath, feeling of having a fast beating, fluttering or pounding heart. So feelings of having fast beating, fluttering or pounding heart. Seek medical care if you or your child have any of these specific or general symptoms of myocarditis or pericarditis, especially if it's within a week after COVID-19 vaccination. Going here, I clicked on more to see more information about this heart inflammation and what does it mean. And here's what the NIH, National Heart, Lung and Blood Institute, are telling us. So heart inflammation, also known as endocarditis, myocarditis, pericarditis. Inflammation is our body's response to infection or injury. It can affect many areas of the body and is a cause of many major diseases, including cancer, ischemic heart disease, and autoimmune diseases. So that's pretty serious stuff, really serious stuff. Inflammation in the heart causes damage and can lead to serious health problems. There are three main types of heart inflammation: endocarditis, myocarditis, and pericarditis. Endocarditis is inflammation of the inner lining of the heart's chambers and valves. Myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the tissue that forms a sac around the heart. Many things cause heart inflammation. Common causes include viral or bacterial infections and medical conditions that damage the heart and cause inflammation. You may have different signs and symptoms depending on the type of severity of the heart inflammation that you have. The treatment your doctor recommends may depend on whether you are diagnosed with inflammation of the lining of your heart or valves, the heart muscle, or the tissue surrounding the heart. You may be treated with medicine, procedures, or possibly surgery to treat your condition and its complications. So you can be treated with possible surgery after having one of these types of inflammation regarding the heart. Complications may include an arrhythmia or irregular heartbeat and heart failure. So these are the complications that these inflammations may include. So it's possible that you have arrhythmia, it's possible to have irregular heartbeat, and it's possible that you will have heart failure. That means dying, your heart will stop function. Explore this health topic to learn more about the types of heart inflammation, the NHLBI's role in researching clinical trials to improve health, and where to find more information. And if we go down here with signs, symptoms, and complications, we can see signs, symptoms, and complications of heart inflammation depend on which type of heart inflammation you have. You may also have different symptoms than other people who have the same type of heart inflammation. Heart inflammation can happen suddenly or progress slowly and may have severe symptoms or almost no symptoms. So you see, guys, may have severe symptoms or almost no symptoms, but we have to take in consideration the worst possibilities, right? If left untreated, complications can include serious arrhythmias, blood clots, or heart failure. So these are the official information that the CDC and the National Health Institute, that's National Heart, Lung and Blood Institute, tell us. These are the adverse events that CDC has verified, at least 1,100 such adverse events in people. So at least 1,100 people, according to the CDC, have had these adverse events, myocarditis or pericarditis, which mean what I just read to you, also from their official sites. The possibilities could be limited. You may be treated with medicine. It's possible to have surgery to treat these conditions. And if we go here, heart inflammation can happen suddenly or progress slowly. You may have severe symptoms or almost no symptoms. If left untreated, complications can include serious arrhythmias, blood clots, or heart failure. So this is what can happen after the COVID-19 vaccine. That's what the CDC is telling us. They confirmed already many cases of these adverse events. They're telling us that most people haven't been having any problems after a few days of care and rest. But under these conditions, you have to know all of these things. You have to know all the possibilities that are after you have any of these adverse events. and you have to take them in consideration, because any of them might happen to you. Any of the worst results of these adverse events, of the symptoms of these adverse events, can happen to you. That's why you have to know these things, and you have to be able to decide for yourself whether you want to take this risk or not. CDC is telling us that they are recommending this to everyone 5 years or older. Inform, think, decide.